Thank you for joining us today for another edition of Conversations with AARP in the Virgin Islands. I'm Troy Deshabert Schuster, State Director of AARP in this territory. Today, we would like to highlight AARP's health principles, the delivery of high quality, affordable, and safe patient care. The COVID-19 pandemic emphasized relatively high risks of avoidable harm to patients, health workers, and the public, and identified a range of safety gaps across all core components of health systems. The pandemic exposed the impact on patient safety, specifically in the care management of persons 65 years of age and older and the disabled population, many of whom were in the high risk category for severe illness or death due to the novel coronavirus. In response, AARP shifted its advocacy work and focused on improving the quality of care through a series of recommendations that would empower patients and their families. At the center of these recommendations was a prominent role of healthcare professionals and their involvement in the safety and improvement efforts for patient care. To gain insight into the shift of care and how we, as patients and family caregivers, can work alongside healthcare professionals in the safe delivery of care, we have invited the Virgin Islands Board of Nurse Licensure. This is your opportunity to hear from Territorial Executive Director Carmen Vanterpool-Romeny and Compliance Administrative Officer Stacey Penn of the Virgin Islands Board of Nurse Licensure and their efforts in protecting the public's health and welfare through the safe delivery of care by licensed nurses. And so we welcome Ms. Penn and Ms. Romney. Good day.
Good day.
Thanks for being on the show with us today to bring our viewers, our listening audience, some interesting and important information about nurse licensure here in this territory. And, there's so much that we need to learn, so much that we don't know. So again, we look forward to hearing from you as we discuss what you do in this particular board. So, if you will start by sharing with us the mission of the Board of Nurse Licensure and its specific role in ensuring the health and safety of Virgin Islanders.
Okay, Ms. Penn will share that with the audience. Go ahead, Ms. Penn.
Good day, everyone. First of all, the mission of the Virgin Islands Board of Nurse Licensure is to identify and promote effective policies and standards for nursing education, practice, and discipline to protect the public. This mission is accomplished through the regulation of nurse licensure, scope of nursing practice, approval of nurse education, and the discipline of licenses. The goal of the VI Board of Nursing is to safeguard the public's health, safety, and welfare through the regulation of nursing education, entry to nursing practice, and promotion of continuing safe nursing practice. We are committed to honesty, fairness, and objectivity in all deliberation, transaction, and relationships. Working with others is a cooperative spirit to build strong professional and public relationship is simply what we are about. The Virgin Islands Board of Nurse Licensure aspires to set the standards of excellence for regulatory agencies by making evidence-based decisions that are legally sound, fiscally responsible, operationally efficient, technology integrated, quality driven, and publicly accountable in the territory of the United States Virgin Islands.
And so when it comes to nurse licensure, we hear of other nurses like LPNs. We hear of CNAs, certified nurse assistants, and so forth. Do you all regulate those types of nurses or just RNs?
The Virgin Islands Board of Nurse Licensure regulates only the professional nurses, advanced registered nurses, licensed practical nurses, and registered nurses, and also certified nursing assistants.
Okay, so not only RNs, but even the certified nurse assistants have to come through your board in order to be am I using the correct term, licensed to
Yes, sir.
practice?
Yes. Yes. All of those nurses must be licensed and credentialed to practice in the Virgin Islands.
Okay, excellent. And so for the RNs, I know there's a specific exam that they have to go through. For the CNAs, is there also an exam that has to be completed?
All licensed personnel must complete exams to be credentialed in their specialty. For the nursing assistants, they must take an exam to with their state to be certified, and then they will get their license as a certified nursing assistant. Prior to that, they're just nursing assistants. With the registered nurses, they have to complete their NCLEX examination. After they have successfully passed their NCLEX, they'll become a registered nurse after that. And you cannot become an advanced practice nurse unless you're registered nurse.
Okay. And what if a nurse is licensed in another state and they want to practice here in the Virgin Islands? Do they have to go through the whole process, or is there some other way for them to become licensed here in the Virgin Islands?
To become licensed in any and we are a part, I must say, we're a part of the national state organization, NCSBN. So therefore, the same requirements in the United States is the same requirement in the territories, and that is including with Guam. They must, we also, all nurses must be endorsed to be practicing in the state in which they are not licensed, which means if I was licensed in New York, if I want to come to the Virgin Islands to work, I must seek endorsement in the Virgin Islands. Currently, we are ahead and we're trying to become part of a compact state, which means nurses will be free to go between states. But as of today, we have not implemented that yet. There are certain steps that the Virgin Islands Board of Nurse Licensure must take in order to begin that implementation.
Now, with that ability, that compact to be able to move between states, what are the assurances that we're going to get good nurses here, that they aren't a nurse that may be running away from a problem in another state? How does that work?
That's a very good question. Actually, with compact nursing, the nurses are have to go through a vigorous check before they can become part of the compact. And the one good thing about the compact is once you have an infraction or a discipline, most of the times you're not allowed to be part of the compact. So the compact is a good thing, and all nurses will definitely have criminal background check, and you'll be able to see their flow of their work or where they have worked with the compact.
Excellent. Well, I'm glad to hear that because we hear stories all the time of uh, people seeking refuge in the Virgin Islands.
And
You know,
and that is true. I don't know if Ms. Penn would like to add some of the things that we are noticing, and that's why I think programs like these are very important for the public to realize that they are not excluded from the dangers of unsafe practicing of nursing in the Virgin Islands, and we do see it. Well, I'll let Ms. Penn give you some examples briefly of what we see. You know, there are cases of fraud, but I'll let her expound on that. Ms. Penn, go ahead.
Okay, so currently there's a lot going on. I just want the public to know that. Not because we're a little needle in a haystack. We are a U.S. territory and we see a lot of stuff, but a lot of people expect that they could come to this little island and, we're a third world and we're not going to pick up on stuff. But we are seeing fraudulent, even within the island itself. We have nurses that, they probably came in from somewhere else. And what happens when it comes to the board? They are required on the application to put that they have a discipline or they haven't committed fraud, but it may be simple stuff, and they come in and they're expecting that, okay, we're gonna not bypass it, but the board, especially the board that we have currently right now, we're picking up on a lot of stuff. I mean, simple stuff like they may have a DUI 15 years ago. Even though it's 15 years ago, we still have to vet it from our end. So, as Ms. Vanterpool was saying, we have our nurses data bank, and I'll probably speak about that a little later, where nurses can be vetted, and we could see all their if they did something, say if it's in California, we'll pick up on that in our nurses database as well.
Yeah, well, I'm glad to hear that because I know that for physicians, there's also a database similar. So that if a physician had any kind of lawsuit or any kind of criminal charge brought against him or her on the mainland, we can see that here and know, how to avoid hiring that physician, bringing that physician into the Virgin Islands or licensing them there,
Yeah.
so we can protect the patients. So I'm glad to hear that there's a similar kind of database for nurses. That's really important. And so going back to something a little more general, but yet very important, what would you say are the key elements to patient safety from the perspective of a nurse?
The key element to that would be just like you, and I always refer to it like, and KYC, know your customer, know your nurse. It's important to know who is caring for you at the bedside, be it in the hospital, in the clinic, in the home setting. And that's one of the areas that we find that people are less likely to do their investigation because sometimes, okay, due to stress, whatever, to get a care provider, it's important that the community know that every person that comes to your bedside claiming to be a nurse, you can have that opportunity also to check and make sure that person at your bedside is credentialed, is licensed to practice as a care provider within the territory. And you can either call the board, we can guide you as to what you need to do because that's on you. You have to make sure you know who is in your home and who is at your bedside. If you're not sure, like Miss Penn said, and I'm going to let her give the audience that information, you can call the board, but also you can go on the computer. Everything is now, we're in the computer age where you can simply check the background of someone. So, Ms. Penn, you can share with the audience where they can go to know who is at their bedside when they can get to us.
Okay. First, I want to say it's very imperative that the public asks pertinent questions to individuals when they come into the home. Um, before the provider comes into the home and take care of your loved ones. Especially if you're hiring an individual providing service in someone's home, it's imperative that you know their qualification, their competencies, the responsibility of that individual. Does the agency, whether it's a RN, do they have a license in the Virgin Island? Does the individual have a certificate to work? Who is their supervisor? These are questions that anyone that's bringing in a nurse to work should ask, especially in your home. As I spoke about earlier, we have what we call nurses.com. It is spelled NURSYS.com. It is a public database. Anyone that wants to vet a nurse, find out about a nurse, they could go on that website. It's a free, like I said, database. Any employer that's bringing in a CNA, RN, LPN, or APRN RN can as well go on this website. Again, it's NURSYS.com, nurses.com. It is a public database. Any nurse that application that comes in to the board as well, that's how we are able to vet a nurse as well. And this is done in real time. So if a nurse is licensed in New York and they have a discipline and it's done on this particular day, we will be able to see it in the system on that same day.
And so what happens if a nurse abuses a patient? Is that nurse's license simply revoked? Are they disciplined in some other way? Can criminal charges be brought against that person? Can you play out some scenarios for us as to what happens when a nurse abuses? And when I say abuse, I mean everything from malpractice, like giving the wrong medication or the wrong dosage, all the way through to some kind of physical or even sexual abuse of a patient.
You want me to go ahead on that, Ms. Vanderpool?
Yes, yes, go ahead.
Okay, so first of all, before anything takes place, a complaint has to be made. That's the first step. Because so say I will give a scenario. Say your grandmother, you have your grandmother is being taken care of, and you notice a complaint. You notice that first of all, I'll say like you have someone at the bedside. You're not certain who they are, or you may know who they are. The patient is, you could physically see that they're being abused. You as the consumer needs to contact the board. Once the complaint is made, then the investigation happens, and that's where I come in. I have to do a preliminary. I usually would interview the person that's making the complaint, and after that I then would contact whomever I need to. So if I may, first of all, I go into the nurses database. That's what I was stating earlier. I will go into the database, make sure that that nurse is licensed within the Virgin Islands. That's one of the most important factors. Make sure that it's within our jurisdiction and that nurse is licensed. Because unless, if it's not a CNA, a APRN, a RN, a LPN, if it's none of those, technically the board has no jurisdiction over that. So that would happen. I would do my investigation. If it's a situation that we need to involve our attorney, the Attorney General office, I will contact our attorney, which is assigned to the board as well, and pass the case. Well, we'll communicate, speak on the case. Investigation continues. If we find in between the investigation, if we find that there's fault of the nurse, we will send out a letter letting them know what the board, whether we want to suspend their license. We have to send notification out. And then in there, if they want to, if they have an issue with what we're saying, then they would contact the board and request a hearing. And the hearing has to go before our discipline committee. If the discipline committee decides that they want to suspend that person license, put them on probation, the individual has to have that hearing first. If their license is revoked or suspended, that information is provided into nurses, which also goes to our, it's called NDPD, which is our Nurse Practitioners Data Bank, NPDB. That information is provided to the public. And it's based on the board's decision how long that license will be, whether on probation, whatever the reprimand is, it's based on the disciplinary decision. And if a nurse wants to fight that, they would have to contact the board. We go through the investigation process again. If choose, the license will be cleared, or it will remain in whatever status it is at that moment. Hopefully I answered everything that you, it was a lot in a nutshell, but yes.
Yeah,
that's really the procedure.
Right. And do you see a fairly high number of nurses going to criminal prosecution, or are they more simple things? Because I've heard some very interesting stories that makes it believe that some of them need to be criminally prosecuted. Do you get a lot of those cases, or not very often?
Honestly, I'm going to speak from my experience, because from since I've been on board in my position, I've seen, we are noticing there's a lot of things that's coming in, because currently, I guess, if I could say, the idea of a compliance officer wasn't really noticeable, but now the board has, I'm here now. I mean, I'm not going to speak before me, but we're out there and we're picking up on a lot of stuff that may have been, not been noticeable in the past. So from the time that I've been here, a lot of stuff has been coming in. I've been picking up on a lot of stuff. People are now more comfortable making that complaint to the board, and we're taking action.
Okay. And the reason why I ask these questions is because at AARP, we're always very, very, very concerned about elder abuse. And there's so many awful cases of elder abuse throughout the territory, all over the world for that matter. But it's amazing how in a small community there can be so many shocking cases of elder abuse, from financial abuse right through to, like I said, to sexual abuse, to neglect, etc. And oftentimes we hear also of nurses who are very unkind, very impatient, very rough. I know of an incident not long ago where a CNA when bathing somebody who was bedridden, tore the skin of that person, um, and caused a lot of pain and suffering, and nothing was done by the employer to reprimand or to correct the situation. It was just a simple apology. And that's a type of abuse. You're harming somebody physically while bathing them. Um, so, we're very, very, very concerned about that at AARP. We want to make sure that our older population, especially our most vulnerable population, those who are terminally ill or very sick or bedridden and so forth, those who are suffering with dementia, various types of dementia, can be protected and know that they're not going to be abused by their caregivers and their licensed caregivers. We would hope that they could trust their licensed caregivers. So, do you at your organization make it known to the people of the Virgin Islands how they can file reports, and how would they find that information?
Okay, they can actually file a report. I'm glad that you mentioned that. And it's important to clarify um, what is licensed and what is not, because a lot of um, individuals are out there claiming to be, and that's why we do not say they are. What is a nurse? Who is your nurse? Where can I get information about the nurse, the person that claims to be a nurse that's taking care of my loved one? And that's where the board comes in. We are available we're at the VI Medical Foundation. We do have a website, which is vibnl.vi.gov. We do, and it's active. We do have a Facebook page. We do have phone numbers, and I will give those at the end of the show so everyone can know where to call, even if we cannot address it, because at the board we are just strictly credentialing and licensing. If it's not the license, if it's not the credential, then it's out of the board hand. It's into the jurisdiction of another department. But that does not mean that the board cannot guide you to where you need to go if you're in the home, or if you see someone is in the home and they're not treating your loved one correct. That's part of our responsibility in a way, because it's scope of practice. However, if you need to be guided, we will guide you to where you need to go. And it's sad that this is happening in our community, and we're well aware. And I'm so glad that AARP reached out to us to get us to let the public know, and especially the community that you're serving, you are important. We know you're important, and patient safety is what we're aiming for. The best nurse at your bedside. As a matter of fact, we want the most excellent nurse in the United States.
Excellent. Yeah, very important, and our people deserve that. My heart always goes out to especially Virgin Islanders who can't afford to go away for healthcare.
Correct.
They're a captive audience here, in a manner of speaking. It isn't like in the States where you can always just go down the road to another hospital or go down the road to another nursing home or find another home health care organization. We're so limited here, and almost imprisoned in a manner of speaking. And so we need to make sure that all of our healthcare providers, all of our healthcare workers are truly excellent, because there are no other options. It is what it is. And so, do you find that we're having a hard time recruiting nurses, excellent nurses in the Virgin Islands and CNAs and so forth?
There is a shortage of nursing all over the world, I would say. Recruitment here, based on what we hear, is kind of difficult, and this board is trying their best to see what ways can we improve on, or if we can assist, because once they come in, the recruitment is up to the agency. The board just credential and the board just license. But of course, as you said, it's a smaller community. Everyone feels the pain of another one because we're all related. And, unlike other larger states, sometimes, and that's why I said you can call us. We are open to get you help. Even though we are focused on licensing and credentialing, you can still call. We might be able to get you that help that you need, but it is a struggle in the United States. Imagine us here. Sometimes fun and sand is not all.
Yeah.
You wish it was that easy, but also, with good nurses comes more, and competitively, that's the recruitment side, not board. I want to make that clear. There's a lot that must be done.
Yes. And so, at the Board of Nurse Licensure, you do not do what the unions do, the nursing unions do. You're
No,
simply about licensing and credentialing, and then the nurses unions, they're the ones who look for equitable pay increases, etc. Am I
I'm
correct?
so proud. You
Yeah.
got it. You got it. Perfect.
Yeah,
Well
I know that
said.
many people get that kind of confused, and I'm sure you get both. Like I'm sure a
Yes.
lot of people go to the union to complain about poor nursing, and a lot of people come to you all to complain about pay and the like. So
Yes. And one thing I must add while you're at it, a lot of people are complaining, and this is community wide, even government officials, that, oh, the board takes so long, application takes so long. Oh, why does the application have to, why should it take 90 days? Well, there are intricate matters that the board needs to conduct internally to ensure that that nurse at your bedside is clear and is capable of providing the care that you need. I mean, not because Troy called and said, well, I know such and such, she needs a license. No, it doesn't matter. All nurses, no one is, everyone goes through the same pattern, and they must submit all their documents. If you submit all your documents, follow the board guidelines, your license actually is approved much faster. If you refuse to send something as simple, if we ask for 2 passport pictures and you send one, the board requirement is 2. We can't just do what we want because our level of competency, if you cannot follow simple direction as a nurse, then that's crucial to the career of nursing. You follow instructions.
yes. Well, we are out of time. It's been a very interesting conversation, and we thank Ms. Vanterpool-Romeny and Ms. Penn from the Virgin Islands Board of Nurse Licensure for being with us today to share all of this very important information. Please remember, if you need to check out a nurse to see if that person is licensed or credentialed here in the Virgin Islands, or if they have a great record, make sure to go to nurses.com. That's NURSYS.com. And you can search out that particular individual there and get all the information you may need to make sure that you're receiving care from a person who is licensed, who is credentialed, and in good standing. So again, Ms. Penn and Ms. Romney, thank you so much for joining us. We look forward to having you in a future show with us here at AARP.
And
Thank
and
you.
thank you.
Have a great day.
Okay, you